And I'm going to take this half of a Dr. Thompson marking stick. Why is it so dark? Let's see. Half of a marking stick, broken in half because I can't get the hole in his mouth. I'll go ahead and put that right through the 2 holes in the surgical stent. Are you able to hear me okay up there?
Yes.
All right.
Dr. Todd, the audio is phenomenal.
Good.
Okay?
Yeah, I don't hear you guys I hear what you're saying, but I don't hear anybody in the background. So here's the 2 holes.
Where does he get the Thompson?
Can you move him up to the middle of the screen? His implants right to the middle? There you go.
We sell a box of 100 or a bottle of 100 for
Okay.
$45.
So I'm happy with the
And they fit in
positioning
this
there.
real nice.
Yeah.
Just rinse him out a little bit.
So Todd sent this case to himself, right? Do you have it reviewed?
Yes.
And
Yeah, you plan to
A
receive
little
it.
bit dark when I do that, isn't it?
He does that quite frequently.
That's perfect. Can you hold that right there, maybe? Right there. Yeah, okay. What's in, there you go. That's the part that's in the way. So if I put a little cheek cotton roll here, it might keep the lip out a little bit too. So just, there you go. Perfect. All right, I'm going to go ahead and put the surgical guide back in the mouth. Surgical stent back in. And we're ready to make our pilot holes. So I'm using my aseptical motor. Is it painful, Jerry? They're a little bit on the lip. Why don't we put a little cotton wool on the bottom lip too?
Stefan appreciates that advertisement for blood.
Yeah.
Dave, can you ask him why he marked the gun with the Thompson marking
Why he
stick?
marks it is because
Okay.
he's verifying that's where he wants to put the
Yeah.
implants. That's all he's doing.
Go ahead and ask him.
Go ahead and ask him.
Doctor, why did you use the marking stick since you have the guide?
What I like to do is verify. I like to verify that I'm happy with the plan that I made in the laboratory, and I want you to do the same because I want you to make sure that you like the positioning that I planned. So I mark it so I can look at it, and if I'm happy, I proceed. If there's something doesn't look right, for example, if a model got distorted or an impression or whatever, and something is different than it would normally be, I want to confirm that before I drill. Okay? So here's my pilot drill, and like I said, we're going to use the pilot drill guide, and that's how far it's going to go through the surgical stent. We're going to go ahead and make our pilot hole. Open real big. All right? Copious irrigation. 1 pass. We're going to go ahead and do the second hole. We got to take that out for a second. I can't get it in there.
Tell him that's good view right there.
I made my 2 holes. What do you got? What size? Okay, 15 millimeter by 2.5 implants is what we're using. And now I'm going to show you how we take this right off of with the drive lock attachment, right out of the glass vial, and directly into the patient's mouth. I'm going to set the motor now to 35 RPMs. I'm going to do the front one first. Open.
Todd, he can take the mirror out if he wants. We can see that pretty good.
Well, I'm going to get the first one in, and then I'll have to take it out for the second one because I don't have access with the second one in there. Okay, just snapped off, so that means I'm done placing it all the way with the stent. It snaps right off of the instrument. You can take that out now. And go ahead and take out the surgical guide. I'm checking the buckle. I'm gonna go ahead and place that the rest of the way in. Take the back of a mirror handle. Can you hear that?
No, not really.
Can't hear it? Let me tap on it with a little,
Yeah.
Hear that?
okay? Can you, I don't know if you can, let's see the mirror. Touch me from that. We got one implant in place. You see it all right?
Yes.
I'm gonna go ahead and put the stent back in.
Would you recommend trying in the crown?
And
Hey, Dr. Shatkin,
Yes.
would you recommend for us not used to this procedure to try in the crown? at this
yeah, we
point?
can try it in right now. I wanna just show you with the stent in. I wanna show you where the implant is in relation to the hole in the stent. Can you see that? Let's see. Are you able to see the implant?
Yeah. Safe question. It's in the mirror.
Yes.
Yes.
Okay.
Everyone's going, yeah.
So I'm happy with the position of that implant. Let me go ahead and try the crown on right now. With the one implant in place. Make sure that it fits the same as it did. And indeed, it looks perfect. Bite together. Bite's still the same. There's still nice tissue blanching. Go ahead and take that out and we'll go ahead and place the second implant.
No.
To go ahead and make our second hole, the pilot drill guide instrument. I may have already made the second hole. Did I already make a second hole?
Yeah.
Yes, you did.
Drilled 2 holes already? And I'll just go back through again. See, if I was doing this without teaching, I'd be moving a little faster. And I wouldn't be forgetting what I'm doing. But we're going to go ahead and place the second implant. This one I can't use that big mirror. It's just too hard to get in there. But can you still see the implant there?
Yes, we can.
I'm going ahead and placing the implant. I'm going to go all the way in until it stops going in. When it snaps right off of the, now it's off the driver. And you can see the implant's in about 90% of the way. Go ahead and take the surgical guide off again.
Tom, can you ask him to put that
And just for the
in my hand?
teaching purposes, I'm going to use a ratchet driver to place it the last few turns.
Yeah. Dr. Powers had a good suggestion that you try to put it in by hand, so that's good that we're seeing it.
And I'm just showing you what I'm doing is I'm holding vertical pressure on the top of the ratchet. And I'm just using one finger back and forth
It's not your car where you go.
until I get it all the way down
Aaron.
to the proper depth. Are there any questions that anyone has right now? I've got the implants all the way in.
Todd, I'm going to point out something about the way you just put that one in and the one when you put in the handpiece. When you put it in with the handpiece, there is a torque limiter, and it will not let you go over 60 Newton centimeters with this. But with your hand, you can go more. So you want to really be thinking about the handpiece, because the handpiece does have a torque limiter and your hand usually doesn't.
Right.
So you can over torque these, even though they're still going in, you can't over torque them a little bit.
Well, what happens if you can't get it down all the way to the property? You can't, if it stops before you get it down all the way.
Then you
Well,
have
what Dave is saying, when I set my handpiece to 50 Newton centimeters, it'll stop at 50 Newton centimeters and won't go any further.
Right.
If I set it to 60, it'll stop at 60 if it gets to that point. With a hand, it's hard to know how much torque you're actually applying. In this case, it was no issue because the bone is probably around 45 Newton centimeters if I had to guess.
So you'd have to resort to the hand-driven wrench if you couldn't get it down.
Right. I'm trying to crown back in again. Go ahead and bite. And it fits exactly the same as it did after the first one and before I started.
74. They break at 74.
They break at about 72 Newton centimeters. They're not going to break easily, that's for sure. Bite together again.
Correct. Deeper,
Let's see if we can get it.
bigger diameter.
See if I can wash this mirror off a little bit.
Another thing is the handpiece will start beeping before it gets to its limit. So it'll start warning you that it's torquing, start beeping, so you can stop and back out.
That's why I've been letting house these places. He's never ever broken one with it.
I don't know if you can see.
But they make torque wrenches.
They do
Torque
make
wrenches
use
goes up to
torque wrench.
65.
Right,
Oh, it's
yeah.
boy.
Hey Dave,
Yes.
you asked me if it doesn't go to length, is
We can
he,
turn the volume down. Okay, can you see that?
hey Todd?
Can you see that through my mirror?
Yes.
Looks great.
Yes.
I'm holding the crown in with the Explorer so it doesn't fall out. Are you able to see it?
Yeah.
Todd?
Yes?
If,
Yes.
if you have an implant that you can't get to depth, are you more inclined to go to a shorter implant or just go back in with your pilot drill and waller out the hole wider or deeper?
I usually go a little deeper with a pilot drill and try to do it that way. Open a little back.
Okay.
If I can't do it then I'll go to trying to get this in the right spot.
Fair enough, thank
We
you.
lost the crown, don't swallow it. Try to go deeper first and then I'll go wider if I can't. Still can't get it in, I'll go a shorter implant with a little wider diameter. Can you see okay there?
Yes, we can.
All right, I'm ready to cement this crown. I just want you to see how it's seating before I do that. Okay? All right, so I'm going to go ahead and cement this. My assistant is going to go ahead and dry the implants really well. I'm going to use the Shatkin First resin cement. And I'm going to fill the holes in the crown, which I'm doing now. I'm also going to apply the cement around the ball and square on each of the two implants. I'm going to go ahead and wipe the excess off the crown so that only the holes are filled with the cement. And I'm going to go ahead and cement it. And I'm going to have them bite together on his teeth normally. Open again for a second. Bite. Open. I'll make sure it's all the way to the gum line. Go ahead and bite. All right, just hold that for 4 minutes, Bob. Do not open, okay? If you open, you could screw up the whole procedure. So it's the pressure's on you. Know what's going on. Open up for me. Turn your head toward me, Bob. You see, it cleans up really, very easily. The cement is very easy to clean. Everybody's always concerned about tissue health, but I will tell you that the vast majority of the patients that have this procedure done, here's how the cement cleans off very nicely. Just kind of flakes off. The vast majority of the time, the tissue does very, very well and stays very healthy. And here we're just going to go ahead and clean off this. You can see how it just kind of peels away right from the crown. So I got 90% of the cement off already. Go ahead and bite together again, Bob, and just hold it. My dad always said, I don't know why people make such a big issue out of a little bit of tissue. Don't make a big issue out of tissue. Just do the best you can and give the patient good instructions on how to keep it clean, and give them a water pick to take home with them and clean with it. Can you give me a water pick too, so I can show them what the water pick looks like? What about, do you have a tooth? Looks pretty nice. Bite together. Looking pretty good. Open for me. Can you adjust the screen so that it's more in the middle? There we go. And I'll show the lingual side. Hold out air on that mirror, it's fogging up a little bit there. There we go. How's that look?
Good job. They like it, Dr. Shatkin. Dr. Jess says good job.
I'm going to go ahead and floss this. Got some nice contact there. I like the contact. Now I'm going to go right up underneath the crown with these floss. Right up to the implant. Pull it all the way forward. And then do the same thing the other direction. Go right up underneath the crown, all the way to the implant. And he can do this on a regular basis, every day. Clean his teeth. I know you're going to do that, right, Bob? Floss his teeth daily, at least 4 times a day, right? I'm kidding. Well, because I know you're not going to floss so well, I'm going to give you this water pick flosser. This is a portable one. You can take it on trips with you. Alright? That's a gift for you.
You ever try to get people?
And I'm going to check the occlusion now.
I'll use it for a
And
while.
I like this type of microfilm articulating paper. Right together. Open.
Is that by Parkel?
Looks good.
So occasionally.
Very light occlusion, nothing too heavy. Right together.
Todd, is that microfilm,
Open.
is that by Parkel?
Bite. Is it Parkel?
Multiple unit bridges.
It's AccuFilm.
That's part.
AccuFilm. I don't know who makes it. Accu.
Thank you.
Here. Made by Parkel. You are correct, sir.
I have it in my, I don't
There.
use it.
All right, and he is all done. His tooth looks perfect. Nice and solid. Can you hear it?
It's difficult to hear it, Dr. Shatkin.
I'll put the microphone down there.
Yeah. It's the best Bob's ever looked, though. We do. And what are you listening for?
It's solid.
Nice solid. Oh, they want to hear a solid sound like I heard it. I'm all tangled up now. You got me all messed up. Okay, so now all we're going to do is get an x-ray and give Bob a prescription for some antibiotics. Do you have any allergies, Bob? No, I'm going to give you some penicillin. I'm going to give you something for discomfort as well. Let's see if we can get a picture of it, a view of his smile now. Smile as big as you can. Zoom right in there. Can you zoom right in? Let's see, zoom in even closer. See if I can get a real close smile of his. Let's see what we can show here. Bite.
Nice.
How about the retracted? I'm going to check retracted. See if we can go ahead and close. Can you see it all right?
Yes, we can see it fine.
Zoom right in there, Jeremy, all the way in. A little more. A little more. There we go. Perfect, right? Okay. We'll go ahead and get the x-ray now, and I'll write a couple prescriptions for you.